So Dr. Lamo here, naturopathic physician with a practice solely focused in cancer care for over 20 years, my entire career. So I wanted to talk about a little bit about the subject of repurposed medications. For example, there's all this talk now of ivermectin, fenbendazole, mebendazole, and the rest. And so I just want to say that, first of all, this is not a new subject matter of repurposed. I've been around it my entire career, but now more than ever, there's been this explosion of interest. It really is a very broad explosion of interest, and I'm finding across really broad demographics, unlike probably never before. And so one of the things that I've noticed is that, and we're a practice where we're always trying our best to ensure patients are safe, they're being monitored. I don't want patients to hide from me, and because when people hide things is when I've seen sometimes some really bad things happen in some patients. And so transparency, we're always trying to earn patients' trust and understanding in these areas, and not scare them away from us and from other levels of standard of care, which is easy to do in certain groups. But what I've learned is, and we're more seeing, is that when patients are claiming that, or media stories or social media stories are claiming that, it was this one magic repurposed medication that, say, really treated my cancerous disease, usually what in terms of variables, these patients are doing, honestly, like 25 to 50 other things, so they're doing all kinds of interventions, and which can also include levels of standard of care, so meaning surgery, chemotherapy, radiation, immunotherapy, targeted treatment, etc. So it becomes quite complex to try to determine what the variables could be. But yet it would be some of these repurposed medications that are getting more of the attention. Not to say that, there's been some papers showing that perhaps some of them may help open the doorways of response, but they don't tend to be leading guns in these areas. And there's research to kind of suggest that with some of the various medications that are out there that are of interest. So again, just keep in mind that it's a lot of the times when you're hearing these stories. So for example, when Mel Gibson was on Joe Rogan saying he has these friends that are doing amazingly well, apparently, like, we don't know anything about them. We don't know what kind of cancers they have or had. We have no idea what other things they're incorporating. We have no idea the levels of standards of cares they're doing, chemo, radiation, surgery, etc. And I think there should be we're at a time where maybe some of these details should be better discussed, right? Especially some of these stories that are being discussed, like what are the underlying variables, and so a better understanding in these cases are, so that we can all learn from, and that we can all better understand, and so we can better help people down the road. So it's a wild west subject area. It's quite larger than ever from what I've seen. There's a lot of understanding that's needed, but I am also seeing that it's not generally just those kinds of medications that people are utilizing. So keep that in mind whenever you're hearing these stories. And so it's not to say that perhaps there are some exceptions to those rules, but generally people are doing many other levels of interventions. Like, so for example, if they're seeing me, that's a whole other level of interventions. And if they're doing levels of standard of care, that's a whole other level of interventions and objective information. So, and it's those kinds of details that I wish to be more broadly discussed, instead of saying yes or no or scaring people away from things. And that ultimately that hopefully patients and people are just they're being guided correctly, and that in a more safe direction, so that the best possible outcomes are ideal for all patients and people that are interested in this area.